When we're doing E-Stim, we want to surround the pain. So if the patient indicated to me that her pain was right here, we'd place the electrodes surrounding the pain. But for the sake of today's learning, I'll also do it up on the shoulders. So we have all of the electrodes over here. We like to keep them in these pouches because it keeps them stickier longer. So it's important when we're, and I had trouble remembering to do this too, to put them away at the end of the day.
Did I not put them away at the end of the day?
One time.
Okay. But not this weekend?
No, they were all in.
Okay. I don't think I put them away on Friday. I think you did that, but I don't remember that.
So we just insert it into the electrodes, red and black. And they can be a little bit tricky, especially when they're brand new. You have to kind of force them in. But just making sure they're as in as possible. And then I'll drape it over the patient and access the area that I am looking for. So I'm starting off with black. Her pain was right about here. So I will go and make sure I have full contact over that muscle belly.
Where did you put it?
Just right about here, because I'm going to surround the pain. So that was black, this is red. So the red will go low.
Because we crisscross the red and blacks.
So red, black, red, black. Making sure they all have full contact with the skin. Otherwise, it puts a lot of energy into just a small spot and it might pinch or hurt. So we're doing the same thing with the other set of electrodes. And the doctor might say, oh, we're going to do upper and lower. So when she says that, what she means is upper and lower back.
Okay.
But some patients, they'll have pain in their mid-back or in their glute or their knee, and so it just adjusts the therapy based on the needs of the patient. Okay.
So theoretically, you could do it anywhere on the body,
Yeah.
but we primarily do it upper and lower back.
Exactly. So, starting with black, I'm going to put it just outside of her shoulder blade.
Where was that at?
Just outside of her shoulder blade.
Okay.
And then on the other side. And then this area right there.
So it goes like on the top of the shoulder.
And never on the spine or the bones or the shoulder blades, right?
Right, you want to avoid bones and just put it over muscles. Okay, so we've got the patient set up. Did you want support under your ankles?
That'd be great.
Where is it? Hold on, let me find. Ah, it was right next to me. Okay, and gently lower down. Does that feel comfortable?
Yes, thank you.
And that just helps to relieve some of the pressure from the lower back. So then coming over here, we're going to get started on the E-Stim. So to get started, you have to press stop first, and then make sure that the appropriate pathways are lit up. So we're doing A and B, so I press B, and then press start. And we'll get started whichever side. We're starting with the lower side, B. So my cue to the patient will be, let me know when you start to feel it. It should feel like a gentle buzzing.
I can feel it.
Great, then we want a level of intensity but not discomfort. And I'll just start gently raising it up until she tells me,
That's good.
right there? Perfect. Moving on up to channel A. Let me know when you start to feel it.
I can feel it.
Great, and then when we reach that desired level of intensity,
That's great.
right there?
Yep.
Perfect. Okay, you have about 10 minutes, just relax. And then I'll go and get the heat started. We just turned the hydroculator on, so it might not be warm. Would you like me to put it on anyway?
Sure.
Okay.
Just for videoing purposes?
Yes, and sometimes the pressure of it is nice. So I'll put a towel over the area that we're going to be placing the heating pad. We typically do the large one for the back and this odd shaped one for the neck. So we have these tongs. You can use them for anything that's submerged. Like this one I can just pick up because it's not fully underwater, but these are submerged. Pick it up, and it's not too hot right now. Okay. Pretty well. Put it in there. And then for this one. So it's important to check the level of water in the hydroculator and make sure we have enough in there.
Whoa.
Week to week. Since it isn't too warm, I'm going to just do one piece of towel and place it directly over the pane. Is that a good placement for that one?
Yes.
Great. And then this one, this curve can go up towards her neck. Does that feel like a good placement for you, Lee?
Yes.
Marvelous. Again, you have about 8 minutes left. Just relax into the table. And then we'll let her go for 8 minutes and we'll do the whole thing in reverse.
Great.